My name is Sanjay Gupta. I'm a cardiologist in York, and today I wanted to do a video on the subject of ageism in medicine. This video is entitled Ageism in Medicine, the Quiet Disrespect. There is a quiet prejudice in medicine that many don't talk about, but almost everyone over a certain age has felt. It is ageism. And it is not always cruel or obvious. Sometimes it's just the sigh, the shrug, the assumption that you're old. What do you expect? So today I want to talk about how ageism shows up in healthcare and why it is time we did better. What is ageism in medicine? Ageism is the assumption that older patients are less worthy of care, less capable of recovery, or simply expected to decline. And it can be subtle, such as not offering treatments because of age alone, or speaking only to a younger family member, or dismissing symptoms as just old age. Imagine being told your pain, your memory loss, your fatigue aren't worth investigating because, well, you're 82. And it has real-world consequences. It results in undertreatment, so older patients may not be offered surgery on account of their age. They may not be offered rehabilitation, or they may not be offered certain medication due to age stereotypes. Conversely, overtreatment can also happen, where you end up having aggressive interventions pushed upon you as an older patient without getting a full explanation of the risks or alternatives. Mental health tends to be dismissed more often in older patients, so depression in older adults often goes untreated and is assumed to be normal. And there can be real communication lapses because sometimes at least, older people get spoken to like they were a child, which is so offensive, or ignored altogether. And I think what ageism does is it misses several key points. Many older adults are resilient, they're motivated, and they value autonomy deeply. They may prioritize quality over quantity of life, but that's their choice, not the doctor's. And I think age is a number. Function, values, and goals matter so much more. I think we should treat an 88-year-old who wants to stay sharp and mobile very differently from someone with advanced dementia, but both deserve respect. So how can we do better? I think, again, it's very important to ask the question, what matters to you, rather than what's wrong with you. I think it's important to look beyond age, consider frailty, cognition, independence, personal goals. It is so important to include older patients in discussions, not just their children or carers. And I think we should be challenging colleagues who stereotype or rush care for, open quotes, geriatric cases, close quotes. We need a cultural shift. Medicine must evolve, not just scientifically, but morally. We need a healthcare system where old age is seen not as a burden, but as a phase of life deserving just as much curiosity, care, and dignity. It's not about treating everyone the same. It's about treating everyone as a person. So if you or a loved one has felt dismissed in medicine because of age, you're not alone, and you're not imagining it. Let's bring awareness to this bias and create a system that treats people, not birth dates. If you've experienced ageism in healthcare, either as a patient or a carer, again, I'd love to hear your story, and I would very much like it if you could share this video with anyone who may benefit, particularly if we believe in humanizing medicine at every age. Thank you so much.